is a mommy makeover? This is a term that we commonly talk about. It gets thrown around a lot, but mommy makeover is a combination of procedures that address changes of the breast and of the abdomen that are associated with carrying babies to term. Yeah, that's a great question. Can I have kids after I have a mommy makeover? The short answer is it depends. Most moms who come in to sort of change and improve the appearance of their body after having children, especially where the abdomen is concerned, need to have their tummy muscles realigned. And sometimes they use the term tightening the tummy muscles. I think a better, more accurate terminology would be realignment of the tummy muscles. So they take those six-pack muscles, they're running straight up and down. There usually is a gap between those muscles from carrying babies to term. Babies, of course, stretch those muscles and that space out. And so we realign those muscles. We bring them back to the midline and secure them there. And we do that because it has a really dramatic effect. It tightens the tummy, it brings the waist in, and it really helps us achieve a nice trim look. Most moms have this. Most moms need their muscles plicated or brought together. And for those women who do, we strongly recommend they avoid subsequent or future pregnancies. So when I see folks who are interested in the mommy makeover and we talk about that particular topic, I want them to be through with family planning. There are some exceptions to this. A mini tummy tuck or a tummy tuck without muscle work is a good exception in the sense that if you haven't had those muscles tightened or realigned, and you can avoid or skip that part of the procedure, you can go on to have future pregnancies. Of course, not all pregnancies are planned. We know some women get pregnant after a tummy tuck, after having their muscles tightened, and of course they can carry a baby to term with no detriment to the fetus. It just makes it uncomfortable for the mother, and they start to experience third trimester symptoms in the second trimester just because their baby and the growing uterus doesn't have as much room to grow. So it tends to kind of go up and push on the diaphragm and some of the stomach and so forth earlier than it typically would. Great question. What's the recovery time after a mommy makeover? Most of the recovery after mommy makeover has to do specifically with the abdominoplasty portion, treatment of the tummy. And most of the recovery associated with that has to do with, again, plicating or bringing those muscles back to the midline. It's the most uncomfortable part of a tummy tuck. Again, nothing we can't do in an outpatient setting comfortably. We typically use pain pumps or a medication called Exparel, which are analgesics that help with the pain in the tummy muscles. But because of that muscle work, we tell people who are not physically active in their work, they can go back to work around 9 or 10 days. Who are physically active, those who are physically active in their work tend to go back after 2 weeks. Great question. How long do we have drains after a mommy makeover? Again, I typically don't use drains on the breast, just a drain on the tummy. Usually I just use one drain, and that drain stays between 10 and 14 days. Now there's a caveat to that. The short answer to the question, how long the drain stays, is it depends. It depends on the output. Drains have fluid that comes out the drain and into a little reservoir. That's the whole purpose of the drain, to evacuate the fluid so that those tissue layers on the inside hold hands and grow and heal together very well. Sometimes people are putting out a lot of fluid and that drain can stay longer. I would say about 10% of the time drains stay longer than 2 weeks. Again, we want that drainage to be less than 30 cc's. That's 1 fluid ounce in a 24-hour period before the drain's ready to be removed. That's a great question. What are the risks associated with a mommy makeover? And so I feel like most of the questions I've been asked on this topic, at least with this group of questions, speak more to the abdominoplasty or tummy tuck portion of the mommy makeover. Now, let's not forget, mommy makeover is a procedure that involves both the breast and the tummy. So restoration of the breast to pre-pregnancy state, or to the desired appearance or goal, has to do with what you have when we begin. For some women, it's a breast augmentation. For some women, restoring the breast is a breast reduction. For some women, it's an augmentation with a lift. So it depends. The risks in general are bleeding, infection, healing complications, and again, if a lift or a breast reduction is part of that procedure, there is a risk that you could have decreased sensation to the nipples and or decreased blood flow to the nipples. All right, guys, thanks for asking all those great questions. Mommy Makeover, it's a big topic, and I hope I touched on some of those questions that you have. Hope we gave you some answers. If you keep asking them, we'll keep answering. Thanks.